Do you have questions about what the vagus nerve is? Well, I'm Dr. Owen Scott Muir, and I have some high-level answers. There are a bunch of cranial nerves, and we're going to get into it, which is thrilling if you like things that are kind of boring. Most of the nerves that control your body run through the spine, but not all of them. There are 12 separate named nerves called the cranial nerves that come out of the skull and control a lot of important functions in our body. For any of my readers studying for medical school exams right now, this will be maybe useful. And for the rest of you, you'll have some idea of what the doctor is talking about. Cranial nerve 1, olfactory. That's the series of nerves that go to your nose and make it possible to smell anything. Cranial nerve 2, well, it's the optic nerve, and that's the giant nerve going to the back of the eye. The eyes are actually part of your central nervous system functionally. So optic nerve, that's cranial nerve 2. It turns out it's not good enough just to see things, but you have to be able to move your eyes around. And cranial nerve 3 controls a series of muscles that control the movement of the eye, and that's called the oculomotor nerve. Cranial nerve 4, here's where I admit a little secret. I'm trying to do this from memory, and so if you see me fumbling, it's because I literally don't remember it because it's been forever since I had to do this, like a lecture format. The trochlear nerve and cranial nerve 6, the abducens nerve, help move the eyes around. We're getting there, I promise. Cranial nerve 5 I find very exciting, and it's called the trigeminal nerve. This trigeminal nerve has 3 different divisions, and it's cranial nerve 5, so we call it, V, right? Roman numeral, these are all Roman numerals. Division 1 is your forehead. Division 2 is the middle of your face, and Division 3 is the sensory innervation of the bottom of your face. So the trigeminal nerve gives rise to the sensations you have all over your face and head. There are actually some medical conditions that go along with problems of the trigeminal nerve, the most famous of which is called trigeminal neuralgia. And that's a condition where you get periodic and searing pain in half of your face. The trigeminal nerve is also important because it actually allows jacking into the matrix of our brain through stimulation of the sensory component of that nerve. So you've heard on this newsletter about the Monarch ETNS device, which stimulates on the forehead here. That's actually stimulating cranial nerve 5, division 1, and that can help reset brain networks by using the stimulation of that cranial nerve to essentially jack into the brain, but without the big spike you need for the movie The Matrix. To explain all the muscles of extraocular motion control before, we went a little bit out of order. We included cranial nerves 3, 4, and 6, 6 the abducens, and now we get to skip it. And this is why we do a little bit of homework in advance. Onward. All that moving around of my face I was just doing, that was me showing you cranial nerve 7, the facial nerve. This is the nerve that controls the muscles of facial expression, of which there are too many to bother to learn in the first year of medical school, but if you go into ENT, you will learn all of. Notably, medical conditions that are common enough as it relates to this nerve are things like stroke, where you can get paralysis of part of your face, and you can see half of it droop. Right? You can also get Bell's palsy, which is a transient paralysis of half of your face. So you get a little droop. It's not complete paralysis, but it is reduced ability to move your face around. And usually this is on 1/2 hemiparalysis, only 1/2, because we have the facial nerve on the left and the facial nerve on the right. Just like we have cranial nerve 5 on the left and on the right, these things are split down the middle. And moving around your face is what the facial nerve lets you do. Ta-da! Can you hear that? If you can, it's because you have an intact cranial nerve 8. This is another big one. I mean that physically. It's a very large nerve. So this is called the vestibulocochlear nerve. and it includes sensory information from both the cochlea, which is a specialized organ that lets you hear stuff, and the vestibular apparatus and its 3 semicircular canals, which gives the brain information about our head's position in space and its angular momentum. Common problems with cranial nerve 8 would include deafness and positional vertigo and your head spinning. By the way, pro tip when you're either getting a history from a patient or giving a history of lightheadedness to a doctor, define what you mean when you say dizzy. It's either lightheaded, do you feel like you're gonna pass out, or it's the room is spinning, which is vertigo, and those have different physiological bases. Vertigo, that's somewhere along the vestibulocochlear nerve or the inputs to it, that feeling of faintness, that's most often something having to do with the blood pressure and the blood flow to the brain, and that can be cardiac output, that can be reduced oxygenation, that can be vasovagal syncope, that can be all sorts of problems that have nothing to do with cranial nerve 8. Oh, yeah. So cranial nerve 9 is the glossopharyngeal nerve. It's one of the very few nerves in the body that has 3 kinds of fibers inside of it. Most obviously, from my little introduction sticking my tongue out, it controls the motor function of the tongue. The glossopharyngeal nerve also contains some parasympathetic fibers. Those are the rest and digest part of the autonomic nervous system. Cranial nerve 10 is the big kahuna. The vagus nerve contains both sensory and motor information, as well as bringing parasympathetic innervation to the body. Our nervous system on the autonomic side is broken up into sympathetic and parasympathetic. And the parasympathetic nervous system, that's rest and digest. And so the vagus nerve, cranial nerve 10, is actually the longest nerve in the body. When anybody says to you, hey man, calm down, they're talking about your vagus nerve firing. This helps slow down the heart and increase digestion, in addition to shunting blood flow appropriately to the GI tract when it's time to rest and digest, not just fight or flight. This one nerve is carrying a ton of information. It's like the superhighway of nerves: tongue, pharynx, heart, gut. The vagus nerve does it, well, not all, but a heck of a lot of it. This makes it an amazing target for therapeutic interventions. You may have heard of vagus nerve stimulation, or VNS. Heck, I wrote about it a week ago. VNS has shown promise in major depressive disorder, pain associated with rheumatoid arthritis, and non-invasive vagus nerve stimulation with the gammaCore device is going through the FDA breakthrough process right now, having already received approvals for migraine, hemicrania continua, and cluster headache. Early data suggests that vagus nerve stimulation can help treatment-resistant depression, post-traumatic stress disorder, and maybe even somatic pain. We'll see. But it's really hopeful to know so many body systems can be accessed by stimulating just one. After the excitement of the vagus nerve, the accessory nerve, cranial nerve 11, it's a little bit of a shrug, and also provides innervation to the sternocleidomastoid muscle, which helps turn your head on both sides, and the trapezius, which lets you do some shrugging. So the hypoglossal nerve is the last one. We're finally at cranial nerve 12. That is control of the musculature of the tongue, and it works along with cranial nerve 10 and cranial nerve 9, glossopharyngeal and vagus, to control the mouth and pharynx for the purpose of talking, swallowing, etc. Thanks for joining me for the Frontier Psychiatrist video explainer series, and I hope this was helpful to a tiny subset of people who need to know what the cranial nerves are right now, and will be helpful to more in the future. I'm Dr. Owen Scott Muir. I'm a child, adolescent, and adult psychiatrist, and thanks for watching.